Welcome to my podcast. Today I'm going to talk to you about another common case, and it's happening here in the UK. So it's about a teenage who is confused about their sexual orientation. So basically, it will be like 15, 16, this sort of age, who arrange for an appointment to see you. And after you introduce yourself and double check the patient name and date of birth, you're gonna start off with, how can I help you today? What brought you here to the surgery? So the teenage will be like not easily opening up from the start. He might feel shy or embarrassed to talk about the issue. So you need to ensure and comfort the patient and say, whatever you're gonna say to me, it will be treated as confidential. He might ask you that not to tell his or her parent. So always ensure that whatever happened in the surgery between you and the patient will remain confidential unless there is safety risk whereby you need to, by law, to divulge and speak about the issue. So the patient might say to you, well, it's kind of difficult and I've been through a situation where I'm not quite sure about my gender. And maybe he's physically a boy, but he feels like he's more into a feminine, or vice versa. And he might say to you that he's been bullied in the school, or maybe he will say that I have a feeling for boys rather than girls. Might say that I'm attracted more to the same sex. So just say, well, I can't totally understand where this comes from. And can you tell me more? When did you realize this happening? Since when? What's going on in your mind? How do you feel about the whole situation? Have you told anyone of your close people? Like, for instance, probably the family or your peers? And what's your mood been lately? So the patient might say to you, no, I haven't told anyone because I'm embarrassed, or I might feel bullied by others because they wouldn't understand. Or maybe he will say, they wouldn't accept me, so I keep secret, I don't talk about it. So you will say that, well, sometimes some people pass through a challenging time, and it could be related to a lot of factors. And you totally can see where this comes from and try to just understand what the teenage want to talk about, and try to see what's in their mind exactly. So what's their ideas and thoughts. So the patient might say that I feel anxious, very worried than usual. So you could say, well, that's expected, and ask if it's affecting his mental state at all, because sometimes it's affecting profoundly. So you need also, after exploring all of that, ask if the patient has any, of course, past medical history, if he's taken any medication on a regular basis, any known allergy. Also, in this age group, ask if they are smoking or if they are taking any sort of drugs at all, and what sort of drugs, recreational drugs. So all of that needs to be asked. Also ask if he drink alcohol, if he had been in any sort of relationship before, started to think about his gender. and if he had any a relationship with the opposite sex before, and if he's sexually active before or currently. So the patient might keep saying that I feel confused, I don't know my sexual orientation. He has mixed feeling. So you could say, I totally understand how all of that could affect you and how it can profoundly overwhelm you. And you can say, and there is nothing wrong for those sort of feelings. Sometimes it could happen. Just try to explore those feelings and don't label them. Ask about if he had any sex education at school, because they do at certain age. So teenage, they are open up and they know about those kind of things. Also inquire if, offer the patient if he's willing to go for a talking therapy, and ask if they have any counselor at school that he could talk to and explore those feelings furthermore. Also ask if there is any support group, for instance. There are certain groups which called LGBT, so he could inquire if there is something like that in the school or in the area around. So he could explore more about this orientation. And also you need to emphasize about there is no discrimination or bully about anyone with any sexual identity, and there is equality for that, and the law for protection in regard. So you need to ask if he had raised the issue with a member of staff in his school, and try to understand where all of that come from. And you could also look for a certain organization or support group that could help him. There is certain support group for this sort of thing. So that could be looked it up in the internet, and organize for a support group for this patient. And as said, for a talking therapy as well, if they don't provide at school. And explain to him that sometimes some people pass through some challenging time, and he's not only alone in that sort of feeling. So all of that need to be addressed. And of course, tell him that there is no hurry in making up your mind about your sexual orientation. You could take some time to explore it and understand the situation, why it happened and where it come from. And then he could decide later on if he want to do something about it. It's a major topic anyway, here in the UK and in the West, that sometimes teenage feel confused about their sexual orientation. And there is certain clinic which is mandated for this sort of thing. And so basically that's how you need to tackle this station, just to understand and explore all of those feelings and try to see if there is any support group that you can help with. And of course, tell the patient if he had any low mood at all, or if he felt like distressed, you can hand him something called crisis card with a number, and reach out if he felt that he needs any further help. So all of that need to be addressed. And don't forget about arranging a counselor. And for that, I hope that I briefed in short about situation in Lab 2 case stations. And that's it for now. Thank you.